decades to decades. And so most recently, one of the things that we've done is we've tried to get out to surgeons and surgical centers what you can do to try to avoid TAS.
Relative incidences of the different etiologies changed over time?
The incidence is not only going down, but each of these areas that we found were problem areas.
From the 7th annual winter meeting of the IIRSI in beautiful Amritsar, I'm Josh Young. I'm here with my dear friend Nick Mamalis. Nick, we're talking about really a very, very serious, maybe the most serious subject, which is TAS. I'm going to ask a favor. So for those audience members who are not completely versed in what TAS is, can I just ask you to give some background, and then I want to talk about more specifics and data and all of those sorts of things.
Certainly. Toxic anterior segment syndrome, or TAS as it's called, is an acute sterile inflammatory reaction occurring in the anterior chamber of the eye following any anterior segment surgery, especially cataracts, but also even glaucoma surgeries. And this is an entity that will show up within 12 to 72 hours after cataract surgery, and it's characterized by an acute, very toxic looking anterior chamber reaction.
So what are some of the understood etiologies, and then I want to talk about the studies that you've done.
You know, the most common thing that we found that's related to TAS is got to do with cleaning of ophthalmic instruments, sterilization of ophthalmic instruments, and then also products that are used in the eye during cataract surgery. Those are the most common causes.
So tell me what the historical data are, and then what the newer data are.
We established a task force in 2006 to study the causes of TAS, and over that time, we periodically will go over our data from the TAS outbreaks that we've analyzed over a period of time. And the nice thing now is we've got enough data that we can compare decades to decades. And so most recently, we looked at the incidence of TAS from 2012 to 2022, and then compared it to the decades prior. And what we found is, first of all, the most important thing is the incidence of TAS is actually falling. And so we're finding TAS is much less frequent now, and we're seeing some positive trends in that. One of the things that we've done is we've tried to get out to surgeons and surgical centers what you can do to try to avoid TAS. And so we're seeing trends that some of the people are understanding this now. We're seeing less issues with instrument cleaning and sterilization, especially the use of enzymatic detergents. We've seen that going down. We've seen going down the incidence of issues with antibiotics that are mismixed into the anterior chamber of the eye. And overall, we're seeing improvements in the sterilization and cleaning of cataract instruments. And so if these have gone on over the years, we found when we did our last 10-year analysis that the incidence is not only going down, but each of these areas that we found were problem areas have actually gone up, meaning that there's less problem going on now. So people are now getting the word as to what causes TAS and what we can do to prevent it.
So that is marvelous. So this is evidence that the mitigation efforts that you've spearheaded are actually yielding benefits. Have the relative incidences of the different etiologies changed over time?
You know, what we found was that over the time of the studies, we found that instrument cleaning and sterilization has always been by far the most common reason for TAS, and that hasn't changed any over time. But what we were finding is there'd be certain times when we would see spikes in the causes used due to products. And so as products have decreased, as the incidence has gone down, we found that certain products that cause TAS have decreased. And so as we've gotten the word out that you have to make sure any medicine that goes in the eye is preservative-free, of the proper concentration, of the proper dosage, as people have become more and more aware of that, we found that those causes of TAS due to specific medications and things going into the eye have actually gone down.
That is marvelous. It's marvelous. Where do you see things going forward? Just sort of, carry on.
You know, it's one of those things where when we think we've got TAS solved and we find that the incidence is going way, way down, we figure we're not going to see it, and then an outbreak will pop up. And so the problem is you never know where the next one is going to come from. And so we always have to be vigilant. We've still got our task force going, and we're always looking for people to report cases of TAS to us, so that if there is going to be a new trend popping up, that we can jump on it right away before it becomes too widespread.
Do you find, and this may not be something that you've looked at, but do you find that that there's more clarity with the appropriate diagnosis of something as TAS?
Yes, yes. I think as time's gone on, and we've really honed down what to look for people and how to actually specifically define it, we're getting better at going ahead and recognizing, what's causing these, and then getting to the bottom of how to prevent them in the first place.
Nick, this is marvelous stuff. It's important stuff. I commend you for the improvement in incidents is a testament to the work that you've done. Most of all, though, of course, I want to thank you for your generosity with your time with me today.
Well, I appreciate the chance to speak with you. Thank you.
Thank you.